Now to the coronavirus, and we've had the Alpha, Delta, and Omicron variants come and go with COVID-19. Well, now cities are being locked down in China with a new subvariant.
Emma Henderson breaks down what that means. Plus, if we can expect cases to surge here in Northeast Ohio.
Remember that our overall case numbers are dropping, so although the proportion of BA.2 is increasing, it's still a much smaller number than we saw a couple months ago.
If COVID were a tree, this would be the Omicron branch. What we're seeing now is called BA.2. It isn't entirely new, more like an offshoot of BA.1, what Northeast Ohio experienced in December and January. So Dr. Daniel Rhodes says it's not fair to expect a spike in cases here like we've seen happening across China.
And China's approach has been a lot different than the US's approach. I'm not here to say it's better or worse. I'm just saying it's very different. So not many people in China have actually gotten COVID. They don't have immunity through infection. They've been vaccinated, but they've been vaccinated with a vaccine that isn't any of our vaccines.
We've also seen multiple large gatherings in the area, like All-Star Weekend and last week's St. Patrick's Day parade, without any big spikes in cases. Part of the explanation is anyone who got Omicron has a slight advantage at fighting off BA.2 with the antibodies they developed. And vaccines are cutting down on serious illness. In fact, Rhodes says we should be far more concerned with a much more familiar illness, influenza, saying last week they were seeing 23% positivity rates in kids tested for the flu.
Follow what's going on locally, make sure your immunizations are up to date for flu and COVID, and be very careful around people that you know are immunocompromised.
Emma Henderson, 3 News.